Hello, YouTube. This is Nurse Kristen. Long time no see. As you can see by the background, I'm in a different environment. I moved 2 hours north from South Central Florida, South Florida, I guess you can call it, to North Florida, about 2 hours north. So I've been here since January 6th, I believe, of this year, and it's taken some adjustment, but I am getting used to it. It's a beautiful day, so I decided to film near my window and let some natural sunlight in. And I'm just very excited to be at the stage that I am in my life, both professionally and personally. So, quick life update. Like I told you, I moved. I did secure 2 jobs. I still work per diem as a home health nurse during the day, and also I work, which is something I haven't done before. I work in a skilled nurse long-term care unit, I guess you can call it, with 40 beds at night, 11 to 7, 11 p to 7 a, and I'm the only nurse on the floor during that shift. So a lot of responsibility. So 2 jobs, which is usually how it runs. But yeah, just still doing me, still happily single, and just living life as usual. What else? Okay, so that's basically it. Just a new area, new environment, and braces are coming off in about 3 weeks. So I'm super excited for that. I've had these on for about 2 years now, and I am past ready to get these braces taken off. Yeah, I'm going to be having a birthday here in about 2 months. So that's exciting. I will be turning 33. So time is like zooming. It's crazy. And I just realized also that I've been an RN for almost 3 years. I think June 23rd is when I took my NCLEX 3 years ago, almost 3 years ago. So yeah, this coming June I'll be an RN for 3 years, which is so crazy. It seems like it was just yesterday. But also, as a part of this video, I just wanted to give you 5 attributes of the modern day RN. 5 attributes that an RN should have in the modern healthcare world. So number 1, if I'm looking down, it's because I have a little sticky note. I guess I could just put it on my computer. Okay, so number 1, I believe that all RNs should have their BSN. Now, do you have to get it straight, straight away, go to a traditional 4-year program? Well, no. I know that a lot of people have lives, they have kids, they have jobs, they can't just quit and go to school for 4 years. But you can do it on a gradual level. I'll just take myself as an example. I started off at age 21 as a home health aide. Then at age 23, I got my CNA. At age 25, I became an LPN. At age 30, I became an RN. And at age 31, I received my BSN. So all the while I was working and living my life while going to school. I think that's super important. In fact, I believe there's a report by the Institute of Medicine that it's a recommendation. A lot of people think that it's mandated. It's not mandated. It's recommended that 80% of all registered nurses in this country have their BSN by the year 2020, which is obviously less than 3 years away. So definitely getting a BSN can only help you in today's healthcare system and in today's job market. Number 2. RNs must have not RNs, all nurses really, should have a thick skin. People are going to call you names, patients are going to call you names. You're going to have a lot of horizontal violence. And when I say horizontal violence, I mean politics and cattiness amongst coworkers, nurse coworkers. It is an unfortunate but factual thing that nurses do not always get along with each other. And then, like I said, also with patients being rude to nurses. Now, I'd say about 90%, 95% of the patients are great. They're appreciative, they're thankful, they know that you're doing the best that you can as their nurse, and they're grateful. But you have those, it only takes one or two people to really just like ruin your day. Patients that are rude, that think that you're their servant, that think that this is the Ritz-Carlton or the Hilton, and think that you're just there to wait on them hand and foot. They don't realize that you have other patients that you need to be taken care of as well. Some of them will call you names, and I mean, me being a African American female, you can imagine I've been called every single solitary name in the book. So that is my advice for number 2. Please have a thick skin. Not every day is going to be a bed of roses. You will, not if, you will have some bad days. And you just have to get through those days and know ultimately the reason why you became a nurse in the first place, which was to help people and make a difference. Number 3. And this kind of coincides with number 2, actually. But number 3 is that you have to be able to get along with people of different personalities. You are essentially, as a nurse, working with the public. You're going to, like I said, have patients that are great, have patients that don't want to talk, have patients of different ethnicities, different languages, different customs, different beliefs, as well as a diverse range of coworkers as well. And some personalities are just not going to click with yours. But you have to find a way to at least be civil with your coworkers. Maybe you're not going to go out for drinks or hang out on your days off or on the weekend, but you have to find a way to be somewhat civil so that you can communicate in regards to patient care and provide the best care for your patients as possible. Number 4, the modern day nurse, RN, is a leader. You have to have, I believe, some leadership traits. And I believe that's why they do teach leadership class. I don't think they teach it. Actually, they did. They taught it in my RN associate degree program as well as my RN bachelor's degree, my RN to BSN program. But I don't think that all associate degree RN programs have leadership classes. I believe that pretty much all RN curriculum, whatever level you are at, should have a leadership course. You have to be leaders. You're going to be advocating for your patients, speaking up on your patients' behalf in regards to if there's any perceived or actual abuse from, coworkers. Maybe, CNA is going in there and abusing the patient, or a nurse coworker is abusing a patient, or even the doctor is being rude to the patient. Maybe a family member is abusing the patient physically or mentally or financially. So you must constantly advocate for your patients. And in fact, nurses are mandated reporters. We have to report any suspected abuse that we see being done to our patients. And also, nurses have to take the initiative. We're the eyes and ears for the doctor. So whatever we see, that may be, that may be headed toward a bad path, you have to nip it in the bud and call the doctor and let him or her know what's going on with the patient. If you see that one of your patients, like I said, I work in a long-term care facility at night. If I see a patient that's normally completely with it and lucid and usually just they have their faculties about them, all of a sudden they're acting confused and having delusions and hallucinations, I'm going to be thinking, okay, this patient may have a UTI or something of that sort. I call the doctor and I'm going to let him know the changes that I'm seeing in this patient and actually suggest interventions that this patient would need, perhaps a urinalysis with a culture and sensitivity to test to see if this patient has a urinary tract infection, and so that the patient could get prompt and proper treatment. So just things like that, having to take the initiative, having to be an advocate, just very important attributes of the modern day 21st century nurse. And then number 5, RNs should be specialists and experts in their field. So if you are an emergency room nurse, for example, you should strive to get certifications in emergency nursing. Or if you're in hospice, get a nursing specialty in hospice. I would have to do my research and see if there is a specialty in long-term care or home health. I don't think there is for home health. I've already looked, and I don't think there is. But if there's anything like in long-term care and geriatrics, perhaps that's a specialty I could pursue. A certification that I can pursue. So that is number 5. It's just becoming an expert in whatever specialty that you practice. It's good to have the most up-to-date, thorough, expansive knowledge base possible in order to provide efficient, quality patient care. So those are the 5 things that I think a modern day 21st century RN should have. And it's nice to talk to you guys again. I know that I'm sparsely on YouTube. I still watch plenty of YouTube videos. I'm just a person that does not prefer to have my mug out there, 2 and 3 and 4 times a month. I'm perfectly happy making videos twice a year. But anyway, things are going pretty well, as you can see. No plans to go back to school yet. Just really happy being a BSN RN. I don't want to be an NP. I finally decided that. I know I was kind of going back and forth about maybe I should do NP, maybe I should do nurse education. I think I made that a few videos ago. But as for right now, I still don't have a preference or what I would like to do for a master's program. And I really thoroughly believe that if you're going to pursue a master's, you should know what specialty or what path you want to take. So I guess I'm just really happy being an RN. So if you guys have any questions or comments or gripes or props or whatever, leave them down below. I've been still getting a lot of questions on my old videos, which is awesome, considering the fact that those videos are super old. But I'm still, whenever I get a question, a notification that a subscriber or just a regular random person has a question, I am always more than happy to answer it. I'm usually pretty prompt at answering questions too. If you have any video ideas, I'm not going to say that I'm going to make the video right away, but I will eventually make the video if you have any video ideas or anything that you want me to touch on. And I think that is about it. So hopefully next time you see me on camera, I will have my braces off and I will get to show you, I don't even remember what my teeth look like without braces. So it'll be really fun to get them off. But yeah, until next time, I will see you guys later. You guys have a fabulous weekend, and I will talk to you all soon, okay? Thanks. Bye.